Our topic for today is drug administration. For the definition, drug administration is the process of giving out medication to the patient in order to treat or prevent disease or complication. A drug is any substance that alters physiologic function with the potential for affecting health. So there are various routes of administration available, each of which has associated advantages and disadvantages. All the routes of drug administration need to be understood in terms of their implication for the effectiveness of the drug therapy and the patient's experience of drug treatment. So oral route is the most convenient and usually the safest and most often used. However, it has limitations because of the way a drug typically moves through the digestive tract. So the intestinal wall and liver chemically alter and metabolize many drugs, decreasing the amount of drug reaching the bloodstream. Examples are antibiotic tablets and capsules. Next will be the sublingual route. So the sublingual mucosa offers a rich supply of blood vessels through which drugs can be absorbed. This is not a common route of administration, but it offers rapid absorption into the systemic circulation. So the most common example of sublingual administration is glyceryl nitrate in the treatment of acute angina. Then for the rectal route, it offers a valuable means of localized drug delivery into the large bowel. For example, the use of rectal steroids in the form of enemas or suppositories in the treatment of inflammatory bowel disease. Antiemetics can be administered rectally for nausea and vomiting, and paracetamol can be given to treat patients with fever who are unable to swallow. For the vaginal route, some drugs may be administered to women as a solution, tablet, cream, gel, suppository, vaginally, and this drug is slowly absorbed through the vaginal wall. This route is often used to give estrogen to women during menopause to relieve vaginal symptoms such as dryness, soreness, and redness. For the ophthalmic route, there are drugs used to treat eye disorders such as glaucoma, conjunctivitis, and injuries, and can be mixed with inactive substances to make a liquid, gel, or ointment so that they can be applied to the eye. Example is a carbonic anhydrase eye drops for glaucoma. For the otic drop, they are drugs used to treat ear inflammation, and infection can be applied directly to the affected ears. Eardrops containing solutions or suspensions are typically applied only to the outer ear canal, so the otic route example is the gentamicin otic drops. Now for the nasal route, if drug is to be breathed in and absorbed through the thin mucous membranes that lines the nasal passages, it must be transformed into tiny droplets in air or it should be atomized. So once absorbed, the drug enters the bloodstream, and the drug administered by this route generally work quickly, such as sodium chloride or NaCl nasal spray for nasal congestion. Now for the inhalation route, drugs administered by this route through the mouth must be atomized into smaller droplets than those administered by the nasal route, so the drugs can be passed through the windpipe to the trachea and into the lungs. Example are salmeterol and fluticasone inhaler. Now for the cutaneous route, drugs applied to the skin are usually used for their local effects and thus are most commonly used to treat superficial skin disorders. The drug is mixed with inactive substances. Depending on the consistency of the inactive substances, The formulation may be an ointment, cream, lotion, and paste. So these are the differences between the ointment, the paste, the cream, and the gel. So for the ointment, they are usually opaque and greasy. For the paste, they are basically ointment with high percentage of insoluble solid and they are less greasy. For the cream, they are semi-solid and are dissolved with or without emulsion. And for the gel, they are mostly transparent. Example of ointment is zinc oxide. For the paste, we can have the dexamethasone paste. For the cream, example will be the ketoconazole cream. An example of gel is ketoprofen gel. And here are the injection routes. So they can be intramuscular, subcutaneous, intravenous, and intradermal. For the intramuscular, they are given on 90 degree, subcutaneous 45 degree, intravenous via 25 degree, and intradermal 10 to 15 degree. Example of drugs administered intramuscularly are your vaccines. For the subcutaneous, your insulin. Intravenous are the example are the IVF or the dextrose fluids. For the intradermal, your PPD or your purified protein derivative. The following slides are taken in this website, the Bureau on Drug Administration. So these are the different routes of administration alphabetically. So we can have auricular, buccal, conjunctival, until the interstitial. We have intra-abdominal, intracaudal, we have intracorneal, intracorpus, we can have intraepidermal, intraluminal, we can also have intraprostatic. We can also give medication intrathecal to the CSF, intrauterine, and intravesical or within the bladder. We can also give through nasogastric, periarticular, and periodontal or around the tooth. And lastly, we can give it to the subarachnoid, transdermal, and we can even give it to urethra. Thank you for listening.